and what being a parent, what they needs to know about anemia, and what are the preventive measures being a parent you can take for prevention of anemia in your children's. Okay, and coming to the discussion, anemia. What is anemia? Anemia is abnormally low hemoglobin or low RBCs below the normal range for a age. There are some different cutoff values and all. What are the RBCs? RBCs are the major red blood cell. They are the major components of the blood, and they contain a protein called as a hemoglobin, which is essential protein which carry the oxygen and deliver to the body in other tissues for their survival. And anemia is a very common, according to WHO estimates, around about 42% of our children in a toddler age group, 1 to 5 years of age group, they're all suffering from anemia. So it's a global health problem, and it's more common in the growing childhood children and pregnant women. And what are, if your child is having anemia, what are the symptoms you can notice in a child? So mild anemia is very difficult to diagnose. So in case of moderate to severe anemia, so child can show the signs of paleness. So when you compare the hands of a child and the mother or a father, so it will be looking paler than the parental hand. And the child also can have a symptoms like excessive irritability and sleepless in the night, and they won't be growing adequately for their age. So they will show signs of failure to thrive, and they also like easy fatigability child can present, and excessive tiredness. And so they can have something called as a so which is a craving. These anemic children will have a craving for a non-nutritious food items, mud and this wall paint, and also those anemic children, they also can present some signs like a pica. And in very severe cases, child can have a cardiac failures, and that will be, and also the child will have a breathlessness and palpitation also child can have. These are all the symptoms of anemia. So coming to why does child will develop a anemia in a body? So one is either due to the decreased production of red blood cells in the body. That may be because of a dietary lack of iron and vitamin B12 and folate deficiency. So in a malnourished child also, because of decreased production of RBCs also, they can have anemia. And second thing, if the red blood cells are getting distracted at a faster rate than the normal this thing, for example, pathological conditions like in case of red blood cell hereditary disorders like sickle cell anemia and thalassemias, those children also can have a anemia. And in a third entity, if there is a lot of blood loss is happening from a body, like in adolescent girls, so that if any heavy menstruation if they have, so they also can have a iron deficiency anemia. And in growing toddlers and the growing children's, so there will be occult blood loss in gastrointestinal tract because of the worm infestation, roundworm. Those children also, they can show the signs of anemia. These are all the anemia. So there are many different types of anemia, but today I'll be just telling about what is a nutritional anemia. And so the iron deficiencies, which is very common in these growing toddlers and children's. Okay. And coming to the how the anemia is diagnosed, one is by the mild anemia. They are very difficult to diagnose unless until a child get an investigation from other causes. So we'll not be able to notice. And in case of the moderate to severe anemia, based on the clinical symptoms, also we can diagnose the anemia. And the third by laboratory test, one is a complete blood cell count test, which will tell you about the hemoglobin and the red blood cell. If they are really lower than the normal age, normal for age, so then we call it as anemia. And there's something called as a peripheral blood smear also we do, that will tell you about what kind of anemia baby has, whether it's an iron deficiency or it is due to the folate and vitamin B12 deficiency, so or it's due to the increased destruction of RBCs. That also will give you a clue. Okay, so we have some few questions from the audience. So let me just answer about this. So one is yes, how does anemia affects the body? Yes, anemia. So the anemia, whereas the hemoglobin will be very low, which is very important to carry the oxygen to our the body organs and all. If the child has a anemia, so the growth can slow down, and it has been shown that the mental ability of the children, those who have a anemia, that is IQ and all is lower than the normal the hemoglobin children's, and their school performance also will reduce. Overall development and the growth of a baby will be affected very badly if the child has a anemia. And the second question is, how can I prevent my child from becoming anemia? Yes, I'll be answering in a few next the next few minutes. And next is anemia hereditary? Anemia, there are different types of anemia. One is a nutritional anemia, that is due to lack of deficiency of iron, vitamin B12, and folate, and that won't be hereditary. But there are other causes of anemia, those which are hereditary, like sickle cell anemias, thalassemias, and so other RBCs, red blood cell disorders. They can be hereditary also. And which kids are of risk of anemia? So the generally when the baby born, the newborn baby will have a adequate source of iron, but when they starts growing after 4 months of age, they'll start developing anemia. That is where the physiological anemia will start, because by the time the iron stores in a baby would have depleted, which has been transmitted from the mother. And also breast milk is a little contains less iron for the baby growth and all. And this is where after 4 months, 6 months to toddler age, they're all the rapidly growing children, so their iron requirement is very high. So those are all the kids, they are risk for anemias. And so the next question is there any particular diet for the kids need to follow? Yes, and so I'll be discussing about that. And is next question is anemia is common among the children? Yes, anemia is very common in the children, since as I told you, there are growing children and their need will be very, very much. And some few kids will be very fussy eaters, and lack of knowledge about the healthy diet, balanced diet. So these are all the reasons of anemia which can occur in children. So yes, coming to after all these symptoms and what are the types of anemia. Next, how can anemia be prevented in children? So the next preventive steps for a prevention of anemia, which starts from a baby when inside the mother's womb only. So all mothers, the pregnant mother should receive a adequate supplementation of iron, so that baby should will receive a good adequate sources and the stores of an iron. So all pregnant ladies should receive iron and vitamin B complex supplements and all. And as soon as the baby born, there is something the delayed cord clamping. So once the baby born, the clamping of an umbilical cord from which is a connection between the mother and the baby, it can be delayed up to 1 to 3 minutes, so that the more amount of blood will be transfused to the baby during the birth. And lesser risk of anemia will happen in those babies who have allowed a delayed cord clamping during the birth time. And the third thing, and once the baby reaches to 4 months of age, so all newborn term babies, they should receive a iron supplements of about 1 milligram per kg. And whereas in preterm babies, where the physiological anemia starts very early, earlier than 4 months of age, so they needs to take a supplements as early as possible, around 2 weeks of age only. And so after that, once the weaning started, children, the child should have a healthy balanced diet. So So they should all have a semi-solid and home-based food. That is, that can be the khichdi with vegetables, which contain green leafy vegetables like spinach, peas, and this beans and all. So which are rich sources of irons can be added to the khichdi, and they can have this cereal porridges and this wheat paisam, and they also can include a dry fruit in baby diet, which includes the cashews, almonds, and the dates, which are all the rich sources of iron. And also, once the weaning started, the eggs also can be started, which is the good diet, so which is a good source of iron. And the non-vegetarian food like deboned fish and this meat, eggs, they're all the rich sources of iron. We should encourage our parents to give different sorts of all these the nutritious rich food for weaning babies. And also we have to, in a growing children, we should discourage the junk food eating healthy habits. We should encourage them eating the healthy balanced diet, which should contain a major proportion of the cereals, and the one portion of that, suppose imagine a child eating a plate of food, so that food should be full of like kind of cereal, and pot of vegetables should be there, and seasonal fruit every day they should eat at least one or two. And also the food in a day that should contain a good amount of poultry like milk, cheese, and all those things. And also excessive milk consumption should be discouraged, because if the baby is drinking, your child is drinking more than 400 to 500 of milk in a day, so they won't be eating a solid foods properly. Okay, so in those cases they can have a show the signs of anemia when they're not eating properly. And also excessive cow's milk consumption also decreases the iron absorption in a body. And so we have to encourage our kids and parents to give a healthy balanced diet for children to prevent the anemia. That's the one thing. And the next thing is we have to regularly deworm our toddlers and the children. That is the age group from 1 to 19 years of the children age group. They should receive a regularly deworming, that is a albendazole. So twice a year, once in 6 months will be given. So that will reduce the risk of anemia and occult blood loss, which can happen through the GI tract and all if the baby has worm infestation. These are all the preventive measures for anemia. So, and the next set we have some more questions. So let me answer all these things. So we have one question: does the milk cause anemia for a born baby? Okay, so anyways, this question is not very accurate. The milk, I'm not understanding whether it's in mother's milk or a cow's milk. Of course, exclusive breastfeeding we have to promote, and mother's milk is the best one, and it won't cause an anemia. In fact, it will give a nutrition for a baby. Cow's milk, yes, of course, we have to avoid till 1 year of age, because cow's milk, if it is given below 1 year of age, so it can cause allergy symptoms, and it can cause occult bleeding in GI intestinal tract, and all those children they can have a anemia. And also, as I said, the children those who are taking excessive consumption of milk, they won't be eating a healthy diet, and the cow's milk, that iron will be less and the absorption also will be less, so that should be discouraged. And how much does a child iron child needs? Yes. So coming to the treatment and this thing, and one more aspect for a prevention, since the anemia is a global health problem and it's more prevalent in our nation, and our India has launched a program called as a anemia mukt bharat, so under which, so the childrens will be provided regularly the iron and the folic acids. So age group from 1 to 5 years of the age group children, they will be receiving twice weekly 20 milligram of elemental iron, and also with the folate, that is a vitamin B12 B9 supplementation. And the children from the age group from 5 to 14 years of age group, they'll be receiving around 45 mg of elemental iron twice a week. These are all the prevention for anemia. And so, in case the child is more than 14 years of age group, so then they should receive a 60 milligram of elemental iron every week will be distributed. So, this is just to prevent anemia in our growing children. And so, these are all the preventive measures our nation, the India also has been taken. So next question. And yes, if the how to treat the anemia if your child is having an anemia. Yes, first we need to find out what exactly is the cause of anemia. One is by clinical history, we'll come to know whether it's in a dietary deficiency or it's in malabsorption of vitamins. And the second things, when we do the blood test, it will give you a clue about whether it's an iron deficiency or it's because of vitamin B12 or B9 deficiency. If because or any other pathological, that is a hereditary cause of anemia also can be found out in blood test. So in case if the investigations are showing iron deficiency, so iron supplements will be given around 3 mg per kg per day every day, so will be given for a period of 3 months. And also along with that, vitamin B12 and folic supplementation also will be given for children. In case of a hereditary anemias like a sickle cell anemia, thalassemias and all, which may require a regular blood transfusion and along with the vitamin supplementation, so those cases need a regular follow-up, close the treatment intervention and all. So that is a different entity. And so next question is, this is the yes, and yes, how much does a child needs iron? As I told you, for a prevention, all children need 1 milligram per kg per day of iron. So that is an RDA. So up to 5 and 11 years of age group, 7 to 11 mg of iron per day is needed for their daily growth and development and all. And so the next yes, and next question is the just a healthy balanced diet, is it enough to prevent anemia in a children? Of course, a healthy balanced diet is very important for a prevention of anemia, but alone it doesn't provide an good amount of iron which is necessary for hemoglobin and all these red blood cell production and for baby growth and development. Yes, they need a supplementation. So as I told you, the different doses of iron will be provided as a prevention, and the treatment dose is the different one. And next most common this thing the parents will have like okay, my baby is having anemia and the doctor has prescribed this all these supplements. How to take this iron this thing and all? Generally, iron supplements will be taken in between the meals so that absorption will be better in those cases. And also, we have to encourage the children to take a vitamin C rich food like oranges, strawberries, and all, because the vitamin C enhances the iron absorption from my body, and also it reduces the anemia. And once the child has taken a iron supplementation syrup, they have to rinse their mouth, otherwise they will see the staining of teeth, staining of a mouth because of these iron supplementation. And also most commonly these adults will have the notion their mind like once if they take iron supplement, the child can have a tummy upset and this constipation and stomach pain and all. So generally kids are well tolerated these iron supplementation, so it's can be taken safely. So don't interrupt the iron supplementation just because of these minor things like constipation and all those things. And also I advise the parents, don't get panicky when they are taking an iron supplementation. If the child is passing a black colored stool, that is because of the iron supplementation, so no need to worry about that. And next a few questions also we have. So what are all the complications of anemia? Okay, as I said, that these are all the like already I have explained. So the child can have all these slowdown of growth, excessive easy fatigability, tiredness, and their IQ will go down, and school performance also will go down. These are all the impacts of anemia in the children, the growing children. So this is all about the today discussion. Yes. Yes, take home message is anemia is a very common in a growing children, and being a parent, so we have to provide an healthy balanced diet for a food children's, which contains a good amount of cereals, poultry, and this pulses should be there, and this every day in food they should include the vegetables, green leafy vegetables, and broccolis and all those things, and green peas and all can be encouraged, and those who are non-vegetarian, so they can encourage all this fish and the non-vegetarian food, which are the good sources of heme and iron, so also can be encouraged. And anemia can have a very bad effects on our growing children's, so especially on the mental development. So please do take care of that, provide your children so the good healthy balanced diet. And if any doubts are in case of recurrent infections, growth failure and all, please visit a physician and get your child screened for an anemia or any other reason. So if the child has anemia, so it can be easily treated. If you we treat early, the outcome will be better. And that's all about today discussion. Okay, thank you all. With this, I'm ending my session. Thank you. Thank you all.